Good evening, everybody. Today I'm talking about the vitamins deficiencies, and I will start with the vitamin B1. B1 called thiamine vitamin and also called anti-beriberi. So, vitamin B deficiency is seen commonly in the population consuming polished rice as a staple food. Its deficiencies will include dry beriberi, which is peripheral neuritis, or a wet beriberi that will include a cardiac manifestation and cerebral or rinx encephalopathy with cross-cough psychosis. This is for the vitamin B1. The vitamin B2 called the riboflavin. Its deficiencies commonly seen in the children who do not drink milk. It will appear as a scrotal dermatitis, nasolabial seborrhea, dysphagia, and vascularization of the cornea. In the oral manifestation, the patient will have a glossitis and angular cheilitis. The glossitis, the filiform papillae will be atrophied, while the fungiform papillae will becoming engorged and mushroom shaped, and this will give the characteristics of the color magenta color tongue. The angular cheilitis in the vitamin B deficiencies most commonly will be seen in the patient who have a lower vertical dimension due to any cause. For example, the patient have attrition, or the patient have a faulty denture with lower vertical dimension. Sorry for the vitamin B3, not vitamin B4. It's called a niacin. So the biliagra, the symptoms of the biliagra or its deficiency is referred as the 3Ds of the deficiency of the niacin or the B3 are 1. Dermatitis, diarrhea, dementia. So dermatitis, diarrhea, dementia. If it's not treated, it will lead to the 4th D, death. The patient in the oral manifestation will have a bull tongue with a raw beefy tongue. The mucosa will be becoming red, super red, and the salivatation will be becoming profuse. Then we will have, I will talk here about the vitamin B5. Sorry for the number again. It's called the pantothenic acid. If the patient have a low or deficiency in the vitamin B5, the patient will have a burning feet syndrome, pain and numbness in the toes, sleepiness, fatigue are the features. So the pantothenic acid is one of the water-soluble vitamins that is synthesized within the body. The vitamin B6 then, the pyroxidine, it will lead to peripheral neuropathy due to the decreased synthesis of the serotonin catecholamines and demyelination of the neurons. So the vitamin B6 will lead to the peripheral neuropathy due to the decrease of the synthesis of the serotonin catecholamines and demyelination of the neurons. Isoniazid, drug used in the treatment of the TB, is antagonist of the vitamin B6. We have to remember that. Then we have the vitamin B7. I will talk here about the B7, then I will proceed. So the B7 biotin, called the biotin, it's anti-egg white injury factor. Biotin deficiency is uncommon since it's well distributed to the food and also supplied by intestinal bacteria. It's known as the B7 or vitamin H. The vitamin C, called ascorbic acid, we know the deficiency of the vitamin C will lead to the scurvy is characterized by spongy and sore gums, loose teeth, anemia, swollen joints, delayed wound healing, hemorrhage, osteoporosis. It will lead also, the vitamin C deficiency will lead to a defective collagen synthesis. It will give a corkscrew hair pattern, woody leg with a large spontaneous bruises in the lower extremities or other features. Tremor field zone is a classic histological picture in the bone in scurvy. Tremor field zone. The pathognomic sign in the oral manifestation. The pathognomic sign is the swollen and spongy gums, particularly the interdental papillae, involved producing the appearance of a scurvy butts. In severe cases, the hemorrhage to the periodontal membrane followed by the loss of bone and loosening of teeth. Then I will talk about the vitamin K deficiency. The vitamin K is called coagulation vitamin. Deficiency is uncommon, bring about translation modification of 2, 7, 9, 10 blood clotting factors, particularly the prothrombin. So its deficiency will lead to prolonged time clotting. Prothrombin levels below 35 in oral manifestation results in gingival bleeding after tooth brushing. Spontaneous gingival hemorrhage occurs when the prothrombin levels falls below 20. The folic acid, deficiency of the folic acid, it will lead to a macrocytic anemia and glossitis. We have structural analogs of the folic acids like the methotrexate and aminopitrine are structural analogs of folic acid that will be used in the treatment of many cancers, including leukemia. These drugs will be blocking the formation of the folic acid, and hence DNA synthesis is impaired. Of course, the patient with a folic acid deficiency or macrocystic anemia will have a glossitis as an oral manifestation. Of course, in this case, the patient will have a smooth and red fiery color glossitis. The vitamin E decreases man fertility, impaired fetal maternal vascular relationships, and also encephalomalacia and natural muscular dystrophy. Nutritional muscular dystrophy. And I will talk about now the vitamin A deficiency, and we know the vitamin A deficiency will lead to the night blindness and xerophthalmia that's characterized by dryness in the conjunctiva and the cornea, pitted spots in the form of triangular plaques in the conjunctiva. Of course, if the xerophthalmia persists, destruction of the cornea occurs, causing a total blindness. This is known as a keratomalacia. Oral manifestation of vitamin A deficiency, it will lead keratinization metaplasia of epithelium, resulting in increase of keratin formation, occlusion of the salivary glands, ducts, and keratin, enamel hypoplasia, and atypical dentine formation. Enamel is more severely affected than the dentine, and delayed eruption of teeth. Vitamin D deficiency, it will lead to the rickets in the children and osteomalacia in adults, and also it will lead to the pigeon chest, one of the most important features of the rickets. The vitamins D is acting as a hormone. We know the patient having a renal rickets or renal osteodystrophy is seen in a patient with a chronic renal failure. Renal rickets is mainly due to the decreased synthesis of the calcitriol in the kidney. In rickets, the plasma calcitriol is decreased and the alkaline phosphatase is increased. Of course, it will lead in the oral manifestation as delaying of eruption of the primary and permanent teeth, delay. Sometimes misalignment of the teeth in the jaw, development of anomalies in the dentine and also enamel. It will show a very wide periodentine zone with a much interglobular dentine. The pulp hores are elongated and extended high, reaching the dentino-enamel junction. And that's it. Thank you all. I will talk about many things after this lecture, inshallah. See ya.